Hi, I'm Nader Paksima, and in this video we're going to show you various hand splints that we use for various hand injuries. So we're going to start with the mallet finger. So a mallet finger is an injury to the extensor tendon, the terminal tendon, and typically the finger presents in a drooped position. So the finger will be flexed down like this, and it can be passively extended, but the patient can't actively extend it. So the goal here is to put a splint on to keep the DIP joint in full extension. And usually I like to use these aluminum splints, and I like the splint to go dorsal so that it maintains full extension. Now you can also put a little hyperextension into the splint, but not much, because we want to make sure that the DIP joint is in full extension, but not too hyperextended where the blood flow to the skin is impeded. Now I want to show you where to put the tape. First thing you'll notice is that the splint for the mallet finger is slightly longer than the distance from the tip of the nail to the PIP joint. See how there's a little extension here? And that's on purpose. You want it to be a little longer dorsally. So the splint is applied like this. The first tape goes right at the very tip, and it should be snug but not too tight without cutting off the circulation. And then the second piece of tape goes right over here, and it's important that when you put it on, it doesn't interfere with PIP motion. So now, let's turn your hand over, please. So you notice how the proximal edge of the tape is right at the flexion crease, so you can bend this joint and it doesn't interfere with PIP flexion. And you can fully extend it and bend it, and it doesn't impinge. If you put the tape back here, it wouldn't let the PIP joint move. And it's really important to get MP and PIP motion when you're doing these tapes. Now also what you'll notice is that because it has this extension, it gives you a good mechanical advantage. So you can really keep that DIP joint in full extension. So I put a slight hyperextension in the aluminum, which ends up causing the DIP joint to be held at exactly 0 degrees. Also, this little extension back here will help prevent PIP hyperextension. So a common thing that happens after mallet finger is you get swan neck deformity with hyperextension of the PIP joint. This little extension part prevents that from happening. So it blocks hyperextension of the PIP joint, but it allows full flexion of the PIP joint while keeping the DIP joint in full extension. This splint needs to be kept clean and dry. Tell the patients to avoid putting excessive tape on here because of perspiration. The skin can get macerated, and the splint can be taken on and off for skin hygiene and application. Now, the other thing to do is to teach the patient how to take the splint on and off properly. So I always tell them that it's a two-person job, and what you can do is, if you're taking the splint off for hygiene, you hold the finger in extension, and someone has to help you, preferably with a pair of scissors, but they get really good at it. They can do it on their own. And you cut the splint off. Okay, so when this splint gets taken off, the finger gets maintained in full extension, and you maintain the finger always in full extension while you're taking the tape off. And so you never let the DIP joint flex, and then the patient puts their finger right on the table, and then the finger can be lifted by someone else to clean underneath with an alcohol prep. I always like to use alcohol prep because then it can evaporate and it doesn't stay wet. So you would use an alcohol prep to clean the finger, lift it, and then clean underneath it, and then put it back down, and you wait for a waft the alcohol away so it's nice and dry before putting the splint back on. Then when the splint goes back on, again, the tapes get put on like I showed before, and it gets lifted up. Okay, so that's treatment of a mallet finger. An alternative to dorsal aluminum splinting is to use these oval 8 splints. And these are prefabricated splints, and they just slip on like this. And so the idea there is to keep the DIP joint in full extension, and they should not impinge on PIP joint flexion. But as you can see, they can be a little loose, and if they're too tight, they can cut into the skin. So I usually will use this as a splint that you can use when taking a shower, and then go back to the aluminum or different kinds of splints for treatment of mallet finger. Okay, in this video, I'm going to show you how to use a splint to treat a fingertip injury. So if you have a fingertip injury, whether it's a crush from a crushing injury with a nail bed laceration or a tuft fracture or something involving the nail tip, what you can do, first thing to do is put a bandage on. So let's pretend that this is an open situation with a nail bed laceration, we'd put a bandage on. Hang on to that for me for a second. And then the bandage can be secured with a piece of Coban. And a good trick is to start off by putting one piece here to cover the tip, and then you start and wrap on here, making sure it's not too tight, so for good circulation, and just rolling on the Coban so that we have coverage. So let's say you have a splint on or a dressing on like this after you've repaired a nail bed, and now you want to put a protective splint on. So the splint that I like to use is a J-shaped splint. And the advantage of the J-shaped splint is you can put it on and just make it fit just right. And if the bandage is bigger, you can just pop it open a little bit so it can fit on a thicker bandage. And you can size it so that it fits just right. And it's important for it to have this J shape because you don't want to impinge on PIP motion. So sometimes you'll see somebody's gone to CVS or something and they've gotten a splint that kind of looks like a U shape. So those prefabricated splints that go like this, those are no good because they end up causing PIP stiffness because they don't allow the PIP joint to move, and sometimes they don't allow the MP joint to move. So avoid this type of U-shaped splint. Don't use that. Use a J-shaped splint. You can put it on like this, and it can be made to be just snug without causing too much pressure, but it stays on nicely. And then you can tape it on or use Coban to keep it on, and the tape would go right over here at the very proximal portion. Again, making sure that the PIP is not impeded, in terms of movement. So you see how this doesn't interfere with PIP motion. I'll show you here in a second. Another piece of tape would go here to seal this part. And now we can flex the PIP joint and it doesn't interfere with PIP motion, but it gives you good protection against the DIP joint, and it's very easy and simple to put on. All right, this next splint is called the Outrigger Splint, and this splint is very useful for treating finger fractures. And the main advantage of this splint is to immobilize an isolated digit without having to involve the other digits and to put the hand in an intrinsic plus position. So we'll demonstrate here, and we're going to pretend that we have a proximal phalanx fracture of the ring finger. Okay, so let's say you've already done your closed reduction and you got it back where it belongs, and now you're ready to put a splint on. So what I like to do is I have the patient sit like this with the elbow on the table and the wrist on something like a ACE wrap or tape with the wrist in a little bit of extension. And then I'll tell them that when I put this splint on, you're going to keep your wrist in extension, but you're going to bend your elbow, and we do a trial run. Now please bend your elbow right. Now Abby's a trained orthopedic surgeon, so she knows to bend her elbow, but most patients will end up bending their wrist instead. So I'll tell them, no, that's your wrist, this is your elbow, so we're going to bend your elbow but keep the wrist in extension. This becomes important later. So the first thing you want to do is to measure the length of the finger. So this is going to go on the ring finger, so we're going to put a bend in our aluminum, and it's just a little shorter than you think because by the time we put the splint on, there'll be some material, so it'll be the right length. So I usually like to make it about there, so it's just a little shorter than you think, and then we'll put another bend on it right here because this is going to go right here where the wrist is, and the rest of it goes down the forearm. All right, so that's the basic shape. Now remember, when you want to get MP flexion, this is a distal palmar crease, so MP flexion has to start way over here. So the splint has to be sitting here in order to get full MP flexion. If it's sitting here, then you're going to get PIP flexion, which is incorrect. We want to get DIP. We want to get MP flexion, so the splint has to end right here. So the splint has to stop before this distal palmar crease. All right. So when it goes on the forearm, it has to stop right around here, so you can see the distal palmar crease. This way, when you bend the finger down, you're going to get really MP flexion and be able to get adequate MP flexion to prevent collateral ligament shortening. So now we have our pre-bent splint ready, and we're going to use a little web roll. Okay, we have a piece of plaster. So now we have all the material ready, and I've gone ahead and dipped the plaster so it's ready to go. So the first thing we're going to do is make sure the wrist is in a little bit of extension, and then we're going to put on our web roll. And you notice the web roll ends up being way proximal to the distal palmar crease. And then we're going to put in our aluminum splint, and sometimes you need to make little adjustments to the bend to make sure that it sits in a good position. Again, the distal palmar crease is free and exposed. And then we're going to cover it with this splint, and I always work a little ridge into the splint. So there's the ridge that's going to sit right over here. And right now I'm not worrying about this part being pointing in the wrong direction. We're going to fix that in a minute. But I just want to make sure that it's proximal enough. So now once that piece is proximal enough, then we can put another piece of web roll here to prevent sticking, and we start the wrap. The wrap is always done from proximal, from the bottom up. So at this point, please bend your elbow. So we practiced that before, so we have the elbow bend. And we're going to start right here and put the splint on. It should be snug, but not too tight until we get to about here. Now, once we get to here, now the splint has some degree of stability, and we want to always bring the splint to the finger, not the other way around. So if the finger, you don't want to spin the finger and lose your reduction. So now we can line up the final alignment to make sure that it's going to sit in the right place, and then bring the finger to rest on the splint, and then we can start to wrap the finger in and incorporate it into the splint. So what this will allow us to do is to immobilize only one digit and not have to immobilize the adjacent digits and cause any unnecessary stiffness. So here I'm just incorporating the wrap into the finger, and that's probably enough. And I'll also use the tape in a figure-of-8 fashion to maintain MP flexion. So I'll put a piece of tape here, and then another piece of tape right here. Thank you. And then anchor it through the thumb web space. Okay, good. So now if you take a look at this splint, you'll notice that we have only the ring finger immobilized. The MP joint is really flexed to almost 90 degrees. The other fingers are free to move, right? So you can move your other fingers and they're not in the way. And this is nice and securely immobilized, where it's giving protection to the fracture, but it's not causing any additional stiffness. Let's get a good side view of that as well. Can we see the MP joint on there? Yeah, good. And, yeah, okay, and then there's the front view, and that's the outrigger. It's very simple to do, and you can do it for any of the fingers. The flexion is happening here, not here. So in general, I like to use about 5 layers of web roll for protection, and my splints are typically 6 layers of plaster thick. So, here's an example of the typical splint that I'll use. It's 6 layers thick, and I'll use 4 or 5 rolls of web roll. Layers of web roll for protection, and I always incorporate a ridge into the middle of the splint, and that gives it a lot of mechanical stability. So if you notice here in this splint, we incorporated a thick ridge of plaster right here. So even though it's only 6 layers thick, it's very strong because the middle part is 12 or 14 layers thick. And so that gives it structural stability. It's based on a principle of the I-beam, where you get some rotational and torsional stability. In this video, we're going to do a short arm splint, and this can be useful for a distal radius fracture or any kind of carpal injury, or anytime you want to just immobilize the wrist joint without immobilizing the fingers. So what you'll need is about 4 or 5 layers of web roll laid out, adequate length of plaster. I make it 6 layers thick, and you'll need some tape, and it's always good to have a pair of shears handy. So I'm going to dip the plaster. So now we have the plaster's been dipped, and I always like to use a ridge. So we put a fold in there and make a ridge in the middle, and what that does is makes the plaster very thick in some areas, so that it gives it mechanical stability. And then the plaster goes onto the web roll, And we'll have a piece to cover with. And then we have our wrap, which you can use a cling or ace wrap. I like to use a cling. So this simply just goes on. It's just a volar slab, a very simple splint. But a couple of things to remember about it. When you put it on, you want to make sure that you stop right at the distal palmar crease so that the fingers are fully free to move. And if especially in older people with arthritis of the basal joint, I'll do a cutout here so that the splint is not adducting or flattening the thumb. So there's a little ridge right here. There's a little cutout for the thumb, and it stops right over here. The ulnar side is a little lower than the radial side because the little finger, because of the slope of the distal palmar crease, you want to make sure you have full MP flexion. So once the splint has been applied, we're going to cover it and then start with the wrap. Put a finger right on there. Thank you. And then we're going to put a piece of tape to anchor the bottom. Good. And so the thing to notice about this splint is you can see the distal palmar crease. There's full MP flexion extension. It doesn't interfere with the finger movement, and it doesn't interfere with the thumb movement. So the thumb isn't being pushed into an adducted position, and you have good motion of the thumb and fingers, and it will serve to immobilize an injury such as a distal radius fracture that you're going to operate on, or just something that you need wrist immobilization for without immobilizing the fingers. Next splint we're going to do is an ulnar gutter splint. So the ulnar gutter splint can be used for fifth metacarpal fractures and any injuries involving the ulnar side. So let's put the hand up in an arm wrestling position, and let's assume we've already done our closed adduction and we're ready to immobilize the fingers. So you can put a layer of web roll, and the web roll should go on nice and even with a 50% overlap each time. And we'll keep the little and ring finger in a flexed position. Now it's important to put something in between them. So here's a little bit of web roll in between them because that will stop skin maceration from occurring. And then in terms of additional web roll, you can just cut a piece and put it right on here. So now we've got a good amount of coverage without a whole lot being in the palm. So it doesn't cause any maceration or pressure on the palm. So here we'll wrap this on so it stays in place. Okay, and once the under padding has gone on, now we can do the actual splinting. And for this, I like to use two splints, and one's a little shorter than the other one. So the shorter splint is going to go palmarly. And I always like to use a ridge for additional strength and stability of the splint. And that's going to go right here in the palm to keep the wrist in an extended position. And sometimes you'll even wait for this splint to set first, the volar one, so that you can push against the dorsal one without causing wrist flexion. Now we're going to dip the dorsal plaster, and for the dorsal plaster, again, I'll use a ridge, but I'll use the ridge on either end. So this is sort of a double ridge. And that narrows down a 4-inch plaster down to the appropriate width to cover just 2 fingers. So that's going to go on like this with the ridge dorsally. Now when you wrap this up, it's important to keep the wrist in some extension and keep the MP joints flexed. And so because we have that volar splint in place, we'll have something to push against. And we're going to take your wrist out of radial deviation, and now as I'm holding this reduction, I have my left hand is pushing in the palm and my right hand is pushing dorsally to get MP flexion and molding the splint. While it sets. So here on the final product, what you can see is on this ulnar gutter splint, one plaster stops right here. The volar plaster stops right here at the distal palmar crease. And so we don't have bunched up plaster here causing a pressure sore. The second plaster, the dorsal one, came all the way over dorsally. So that's the one that's going to hold the fracture in a reduced position by flexing the MP joint. And the original plaster, the first one, ended here, so there's no plaster right along the finger. And what this does is allows the wrist to be kept in extension, the MP joint to be held at 90 degrees of flexion. We put web roll in between the two fingers so that you don't get skin maceration, and we have a nice reduction and intrinsic plus position. The next splint we're going to do is the thumb spica splint, and the material you'll need for that is some web roll, plaster about 6 layers thick, a smaller piece and a larger piece, and some tape. So here I've already applied the web roll to give even padding, and I always like to do this at the thumb tip, where you fold a piece and you put it here so that you make sure you get enough protection for the tip of the thumb so it's nice and well covered. And the thumb spica splint is going to go just right here along the radial side. So let me dip the plaster. So the thumb spica splint is going to go right here along the radial side, and I always like to put a ridge in the plaster to make sure that there's adequate strength. So there's the ridge, and the splint goes right here, and this one's going to come all the way to just proximal to the IP joint of the thumb. And so it's laid out here like this, has a nice strong ridge, and it's a very easy and simple splint to put on. Now this is the additional, you can put additional splint on, and this little square splint I usually will take and put a little ridge right in the middle of it. And that goes on the palm side, right here, on the palm side, to keep the wrist in extension. So that'll give additional bulk to and additional strength to the splint to keep the wrist in a little bit of extension. And then the splint is secured on with web roll and either ace wrap or some cling. And a note on using the ace wrap, when you put an ace wrap on, you can start with once around to get it secured, and then there should be an even degree of compression and an even roll as you come across. And it should just be rolled on. You don't want to, when you put an ace wrap on, you don't want to pull on it and wrap it on, because then it causes compression, but rather just lay it on with a gentle amount of pressure so that it can allow for expansion. And here at the thumb, I always like to make generous cuts if I'm going around the thumb. Don't make a little tiny hole and stick the thumb through it, because then it can cut off the circulation. So it's better to make nice long cuts like this so that there's no point of constriction of blood flow. So the splint, when it's finished, should look like this. We'll turn your hand over. The fingers aren't immobilized in any way. The fingers are free to move. The thumb is well immobilized, and it's got a nice strong ridge here, and it has the additional kicker here for additional wrist support. And that's a basic thumb spica splint. So this next splint is a sugar tong splint, and we're going to pretend that Abby's fingers are hanging from a weight, and we've just done a closed reduction of this radius fracture, and she's hanging by finger traps. So we want to put a nice even layer of web roll on so that everything is well protected, and especially at the elbow, it's important to pad the back of the elbow so that with any elbow extension, the splint doesn't cut into the back of the triceps. So now it's well padded, and here I've rolled out 4-inch splints. There's 6 layers each, and there's 2 of them. Now the dorsal one is going to go way distal, so it's going to end up right here at the knuckles. And the volar one is going to start proximal, thank you, right proximal to the distal palmar crease. So those 2 are going to end up at different levels. So notice here how the volar plaster stops right here, so you can really see the distal palmar crease so that it doesn't interfere with MP flexion. Hold on to this, thank you. And then use our web roll to shape the splint. Okay, so now we're going to use our ace wrap, and we can start right here. And again, the ace wrap should be applied with just gentle laying on without really pulling on it so that it doesn't become too tight. And anytime we're going around the thumb, we never want to make a little poke hole and stick the thumb in it. That's no good. Don't do that. It's much better to make it a real cut and go around the thumb so that there's no pressure and you're no cutting off the circulation to the thumb. Thank you. Okay, so the important features of a sugar tong splint are plenty of padding around the elbow, especially in the back, the 2 plasters and the different areas. You'll notice over here the dorsal plaster goes distal right up to the MP joints, but the palmar plaster stops at the distal palmar crease. Maybe we'll abduct the shoulder here and take a shot like this so that you can see that the fingers can fully flex down at the MP joints, because the plaster ends right here. And the dorsal plaster goes here, so you can keep your reduction and everything with a 3-point bend. So if you're going to do a 3-point mold here, you know, you would apply your mold and get a nice reduction of the fracture, but allow the fingers to fully flex down and fully come up without any impingement at the MP joint. And you can always use some tape to secure the fixation, and it should look something like that.